out there is having a great day. Everybody on Facebook, YouTube, and X, hope you guys are having a great day out there. Hope everybody in Lubbock is having a great day. We've been busy at the Rock today, all day long, been taking care of people. People say, hey, Doc, what have you been up to? I've been working on spines. That's what I've been doing. Been trying to reduce subluxations, remove interference from the nervous system, and let the body heal itself. That's what we're doing right here. We're doing it all day long, and we finished at 6:59 today. 5:59 tonight. If you guys are on the radio and you heard that little introduction piece right after Robert Pratt, I just fumbled that whole thing. I just fumbled it all horribly. So I apologize for that. I'm trying to be more professional and have more energy and bring it to you every night, night after night after night. And sometimes I just get my tongue all tied up, and it doesn't come off right. And you have to listen to the body of work, not just an individual piece of the work, because over a period of time, the body work will speak for itself. So we've had some good shows this week. I thought our Monday night show was very inspirational. We took health to church. Tuesday night we had a little glitch, but last night we came back and I thought we had a good show talking about the immune system in its relationship to pain, in its relationship to exercise. So if you guys missed that from last night, I actually talked about it this morning. One of the very first, my 8 o'clock class, one of the ladies in my 8 o'clock class, she's like, I'm going to be sore tomorrow after this workout. And I was like, no, I don't think so. You've got more M2 macrophages than you have M1 macrophages. And she listens to the show all the time, but she just happened to miss that one last night because she was dealing with some other stuff. And so I said that's what we talked about last night on the show, was that anti-inflammatory aspect of the immune system. And that same thing goes on with what we do with shockwave. We create a little bit of inflammation to cause a response to get the body to get rid of the inflammation. And any of those things. That one of our listeners called in today, wanted to get in, dealing with some rheumatoid arthritis and having some problems with exercise, right? So that's that. All that manifestation. That's why I'm a big believer in epigenetics and not in genetics. I'm a big believer that the environment upon the genetics is what causes the expression. And we talked about that last night in the show as well. Talked about that expression. And then it came up today. And we usually start the show off with conversations of the day. And then tonight we're going to get into the safety of chiropractic, because I really want to address this. I want to address it so that you guys feel good about it and so that you understand it. And you can rebuke it either publicly or in your own mind whenever you hear somebody talking about it. So we've got lots of research about that, and I want to go over that tonight. But the conversations of the day, there was some really good ones today. But I had one of my ladies said that diabetes runs in her family, and that the reason that her sugar levels or her A1C was high was because of genetics. Her DNA, that's what she said, right? And so I said, no, I'm not. I don't believe in that. I just don't believe in that. I don't believe in that expression like that. And it's okay if I don't believe in it. Like, I have the right not to believe in it. It's my choice whether or not I believe in it or I don't believe in it. And I have some science to say that I don't believe in it. I have some evidence that says to me that I don't believe in it. I believe that your body will express itself if you put it in the proper environment. And I believe that the body will express itself if you put it in the improper environment, which the expression is a symptom of some kind. And so that's, you get told that it's your genetics. Diabetes is in my family, or cancer is in my family, or whatever the thing is. And I'm like, okay, well, it's just so easy to it's so easy to me. If someone tells me that, then it's just so easy for me to just say, well, I'm a victim and I don't have any options. There's nothing I can do. One of my ladies told me today, eating sugar is my happy place. That's what I do, is I eat sugar. And I was like, it's just a definition, right? It's just a definition and strategy. I love that I learned. Scott Latham, right here, licensed counselor. I sat and talked to Scott. We were going to add him to our wellness practice at one time, and I sat and visited. I'd go every Friday, and I got counseling, uh, and I got counseling from a wellness perspective in my brain. Maybe that was my own illusion that it was from a wellness perspective, because maybe it's just counseling instead of being from a wellness perspective. But that's one of the things I learned from Scott, was that this concept of definitions and strategies. And that's how we live our life. We live our life through our definitions. I like red. I don't like orange. That's a definition. It's my own definition. I like chocolate, but I don't like onions. I don't eat chocolate anymore, but that's why I hesitated on that. But there's things that I like. I like tea. I like iced tea. I don't drink Cokes. It's like, it's a definition, and we live our life through definitions. It doesn't matter what we could say any of those definitions, and what we do. Let's just say apples. We'll just say apples as an example. Okay, what if I say to you? If I just say to you, yes or no, pro or con, thumbs up, thumbs down. Which one is it? Apples. What are you going to say? You're going to say yes or no. What is your thing? You like apples? You don't like apples, right? It's not. Then this is not a Matt Damon moment right there. But it's like apples. Okay, for me, yes, I like apples. I want to be careful with the sugar. I got to wash them off. I'd rather eat them organic if I can, because of the outside. I'm going to eat the outside of the apple, so it's the one that gets closest to the pesticide. So you got to try to eat the organic apples or wash them off really good. I like them with almond butter, like them cut up in slices. So I got all these strategies now that I'm fixing to put together. I'm going to put all these strategies together, and it's going to be based on my definition of apples. Now, if you say onions, I'm going to have a whole different set of strategies, because I don't like onions. And so it's like, no, I do not want onions. I do not want to smell onions. I don't want onions. I don't want them cooked up in my food. Don't put them on my burger. I don't want onions. My mom used to say that. She's like, yo, you can't even taste them. And I was like, well, if I can't taste them, well, then why do we put them in the food? What's the point of it? And so I'm not an onion guy, right? So I have a set of strategies based on my definition of onions or my definition of apples. I defined it that I like apples. I defined it that I don't like onions. And so I build a set of strategies. And so one of my ladies today said, it's my happy place. I just can't quit eating sugar because it's my happy place. And I said, well, that's a definition. Just change your definition. And she's like, what? And I'm like, and then we talked it through, and she said to me, well, the truth is I really don't believe that eating sugar is going to make any difference. And I said, there you go. That's the truth. The truth is you really don't believe that stopping the sugar is going to make any difference in the way that you feel. And now you negotiate with yourself based on that definition. That's the strategy building definition that she was working off of. And it's like, okay, it's fine with me if you want to go down that road and you want to continue this particular way, but you've got inflammation in your body and it's like, what you may be wondering, what are you even talking about? You may be wondering that, right? So there's the cell. Inside the cell is the nucleus. There's the DNA. That's what you're telling me is your expression. Expression is over here. And then in my life? Environment. I think it's the environment. I think it's the environment upon the cell in either a macro or a micro type of situation. But I think it's the environment upon the cell which causes the cell to express whatever thing that it's expressing. And if your expression over here is rheumatoid arthritis, I think it's because you put that cell in an environment that's your cell, your DNA may be predisposed to that rheumatoid arthritis. But if that cell is in an environment and it's predisposed to rheumatoid arthritis and you set that DNA off, then you express, of course, the DNA expresses the rheumatoid arthritis. And then it starts to eat away at your joints and it causes all kinds of pain and there's issues and all that sort of thing, right? So is there anything we can do? Is there anything we can do about controlling our environment? Because I cannot control my DNA. And the only way I could control my expression is through changing my environment. And that's what we talked about with last night when we were talking about macrophages. If you exercise, you get an M2 type of macrophage, which leads to anti-inflammation. If you don't exercise, you get an M1 macrophage, which leads us down the road towards inflammation. The expression on that was the inflammation. So same thing with your blood sugar and your type 2 diabetes. Not your type 1 diabetes, but your type 2 diabetes. Your A1C. Your A1C level, your glucose levels, right? That same thing. It's like, what is the environment that you're putting your body in that's causing the expression of A1C to be 7 plus? Like it's up here too high. You're telling me that that's your DNA. I don't believe it. Personally, I don't believe it. So, if you want a different option, that's what chiropractic wellness is. That's why we do the show, right? It's like, hey, look, you choose the option. It's your choice, just like it's my choice to believe in epigenetics. It's your choice to choose the option. If you want a better option than the one you got right now, if you don't like the way you're expressing, I had a conversation. That was another conversation today. One of my guys said, man, I'm just telling you, getting old is not for the faint of heart. And he said, if you don't want to feel miserable, then don't get old. And I said, well, you got any strategies for that? Like, how do I keep from getting old? Like, what do you mean? And he was like, well, and so we started talking about, I said, let me ask you this question. Would you consider yourself someone who eats well, moves well, and think well? And he's like, well, I don't know. I eat okay, but I probably don't move as much as I should, and maybe I don't think as well as I should. And I'm like, okay, well. And then he started telling me about when he went through a time in his life where he completely got off sugar. And you know what he said? He said, I never felt better in my life. He said, my joints were better, my skin was better, my sleep was better. He raised his hands up above his head, and he was like, I used to couldn't raise my arms up because my shoulders were so stiff. And then I just stopped that, and then now I just moved my arms, and I was like, I just barely opened the gate just a little bit, and he just busted right through it. He's the one that told me how great he felt. First thing he was telling me is it sucks to get old, and then within really probably less than 90 seconds, he was telling me how there was a time in his life that he never felt better when he got off of the sugar. And he said, I never got sick either. He said, he's like, it was just great. So, yeah, if you want to live a better life, just eat better food, stay away from processed food, stay away from soda pops and things like that have high fructose corn syrup in them. Stay away from that stuff. Go towards stuff that is not going to cause you that trouble. Try to eat food. I've had 2 or 3 or 4 people today or in this week tell me you can't completely cut out sugar. It's in everything. And I just started going through my list. There's a little bit of sugar in my almond butter. And I just started going through my list about, I'm like, okay, wait a minute. There's not any sugar in my eggs. There's not any sugar in my sausage. There's not any sugar in my raspberries. There's not any sugar. I mean, there is some natural sugar in raspberries, but it's very low. But there's not any added sugar in my raspberries. The point was, they said, well, they put it in everything. And I'm like, well, they don't put it in raspberries. They don't put it in blueberries. They don't put it in chicken breast. They don't put it in hamburger meat. They don't put it in steaks. It's not in a sweet potato, even though a sweet potato has its own natural, there's some complex carbohydrate stuff going on there. I'm not saying that I'm talking about added sugars to things. There's not any added sugar in this tea. It's green tea, unsweet green tea. There's not any added sugar in water. There's not any added sugar in apples. There's not any added sugar in, you can do cantaloupe and watermelon. Those things have high sugar, and they will bring your sugars up. But there's not any added sugar in any of that. He's like, well, do you like spaghetti? And I'm like, well, I do love spaghetti, but I hadn't had it in 3 years and 4 months. But you know what I mean? It's like, it's not as hard as you think. It's not as hard as you think. And you say, well, it's not. It's in everything. No, it's not. It's not in steaks. It's not in chicken. It's not in turkey. It's not in sweet potatoes. It's not in broccoli. It's not in asparagus. It's not. It's not in. It's not in like queso burgers is one of the things we have. Make up a little queso. There's not any sugar in that. Like, if you do it right, it's just cheese and green chilies. There's not any sugar in green chilies. There's none of that has sugar in it. So you can do that. You can eat plenty good and go through that without it. And then if you do that, you'll change the expression of your cells, and you'll make your life better. You'll make yourself healthier. I promise you. Promise you will. And I'm really looking forward. If you're the one that called today and wanted to get in and wanted to exercise, I'm so excited that you listened to the show last night and that you called and you made an appointment today. I can't wait to meet you. I can't wait to get you in the office. I can't wait to go to work on you and help you really change your life. So thanks for calling. I'm really excited about it. I hope we got you. Leslie just told me about that at lunch, and then I hope we got all that set up. And if we didn't, we'll do it first thing in the morning, but we should have already done it. So yeah, I'm excited about that. So let's get into it, because this is a very, very touchy subject to some people. This is when you're talking about certain subjects, it gets very polarizing. People get very upset about things, and I don't want to be insensitive to anybody that's ever been in a chiropractic office where something didn't go right and the person had a problem. Okay, I want to make sure that, because I'm not saying that that is a case, that there's never been anybody to have an adverse reaction in any form or fashion to an adjustment. I'm not saying that, but I think we should be fair when we're discussing the safety of chiropractic and the adjustment. Okay, and I want to be just as transparent. And I want you to know that the chiropractor, especially this one in this office, his entire life is wrapped around the belief and understanding that he's not going to hurt somebody on that table. There's nobody other than the victim that, if someone ever got hurt, there's nobody else that's going to suffer more than me and my family if that was the case. And I don't know how many adjustments I've done, but it's well over 100,000 adjustments. We may be getting close to 150,000 adjustments. I don't know the exact number. This is my 21st year of adjusting patients, and we got to be up in, I don't know exactly what the number is, but we're up there in the 125 to 150,000 adjustments that we've done. Okay, to my knowledge, there's been 2 broken ribs and 1 broken rib cartilage out of 125,000, and they were very unique circumstances. There were patients that I had taken care of for a long time. They got on the table, and it was an awkward position, and One of them 2 weeks later came back and asked me to break the other side. And I'm like, no, I'm not going to do that. Okay. So, but there's an article that Dr. Murphy released this week. And the name of the article is Adverse Events After Cervical Manipulation, Cervical Spinal Manipulation. Adverse Events After Cervical Spinal Manipulation, a systematic review and meta-analysis of randomized clinical trials. It's in Pain Physician, May, June 2024, volume 27. And there were a couple of PhDs and that were working on this thing, cites 46 references. The objective of the study was to extract available information from randomized clinical trials, RCTs, to synthesize the risk of adverse events following high velocity, low amplitude cervical manipulation. And that's what we do when we're adjusting. So high velocity means that, like, when we adjust somebody, and I want to say this, we don't adjust everyone the same. So there are some people that we use the activator on because they don't need this high velocity, low amplitude adjustment. It's not something that is proper for them. Okay, there are some people that they're really hesitant about it, so we use the activator. Or maybe we just use the tuning fork and we work their eyes. Okay, or maybe I just use the drops on the drop table, and we just use the drops. I learned 9 different techniques in school, and I've learned a couple of techniques since I've gotten out of school. And so there are lots of ways that we can approach your care in the office. It's one of the major reasons why I do not take walk-ins in my office. People's like, hey, doc, can I come in? I just want to come in and get adjusted. Nope, I don't do that. You can't just walk in my office and get adjusted. That's not what we do here. You might come with your I've got a patient that brings her mom with her, or I got a patient that a 60-something-year-old patient that brings their daughter, and whatever. And they're like, hey, would you mind just adjusting her? Can I just get you to adjust? Man, that really irritates me when that happens. I had it happen just a couple of weeks ago, and I was just really, really irritated with that situation because it was just expected that I would just adjust her. Like your dentist does that. If you go to your dentist and you bring your daughter with you that's in from college to your dentist, and then you just say, hey, would you just fit her in? I don't think that happens in a dentist office. If you go to your cardiologist and you say, hey, would you just fit my daughter in just because she's in town? It's like, no, your cardiologist wouldn't do that either, right? There's a due diligence that a doctor has to perform ethically and by state board rules, that I have to do my due diligence in making sure that I do the proper things to take care of you. So one of the ways that in our office that we reduce the risk of hurting someone is we do a very extensive physical exam. We do a lot of stuff in our office before we adjust you, and we do your heart rate and your oxygen levels. We do your grip strength. We do a bunch of neurological tests. I'm checking your posture. I'm looking at you. We do X-rays. We just check your brain. I do an extensive history with you, and I've done all the histories. And I've tried really hard to figure out a way not to do the histories because it takes up a lot of my time. I really would like to delegate it to someone else, like my parents got it delegated to when they went to their doctors. They don't see their doctors. They see PAs and nurse practitioners and whoever's there to do a lot of their stuff, and then they come see the doctor. In my office, it's not like that. I'm not saying it's right or wrong. I'm just saying that I sit down and ask you questions. I want to know. I want to know what's going on with you. I want to know. You say, well, I have anxiety. Well, when did it start? Did you have anxiety when you were in college? Did you have anxiety when you were in 10th grade? Did you have anxiety in 7th grade? What went along the way did it start? But I've started having acid reflux. When did that start? Man, I've been having these bad headaches. What do you mean bad headaches? I've been having really bad, excruciating headaches. Well, that's not good, right? We want to know. There's some things we really want to know answers for, right? So this article is going through to see, is there any adverse reactions to high velocity, low amplitude cervical manipulation? So when we do get to the adjustment, I've got some idea about what we're working on. right? And I've got some idea about you as a person, and I've got some idea of your fitness level and your tissue level. And so it's not a blind adjustment, but we're going to do what we're going to do is we're going to take that joint, to its end range of motion, and after you've done 100,000 something adjustments, it's really impossible to explain in your hands what you're feeling, because people say, Doc, what do you feel when you do that? I'm like, I really honestly cannot answer that question. And I don't mean this in an arrogant way. It's like asking Michael Jordan, like, how did you shoot that shot? Or Steph Curry. Like how do you make that? Like, how do you do that? It's like he's done it hundreds of thousands of times. It's in the neurology of the hands, right? So that's what we do with the adjustment. We got to take a break. When we come back from this, we'll really get into this article, and I'll explain to you how safe chiropractic is and how it compares to everything else that you can do out there. You guys stick around. We'll be right back. And I know that might sound a little arrogant, and I sure don't mean it that way. I just mean that it's like I'll check postures, and patients said, Doc, what are you looking at? And I'm like, I'm just looking at you, and I'm looking at everything. I'm just looking at everything that I've studied and thought of and worked through. And those 11, 12, 1 o'clock in the morning conversations that I've had with MJ and Katia in their living room, and that sitting at the restaurant with Joe and Riodoso and talking about this stuff, and those hours and hours and hours of coffee that I used to have with my brother-in-law, while we talked about was chiropractic for hours and hours. It was like those all of those things kind of stack together when you're looking at someone's posture, and you're looking at maybe a head tilt just a little bit in one direction, and look down at their feet, look down at their hands, and we got internal and external rotation, and then look at the hand and look at the head, and then the internal rotation in the head, and that works together. And you know what I mean? It's like there's a bunch of stuff that goes into that right there. And then when you go to adjust them, are you adjusting a specific bone for a specific reason? Yes, but it's evolved in 21 years. It's evolved from one level of adjustment to a pattern of adjustment to a pattern based on neurology of adjustment. See, it has a pathway, and I want to wait till we get back on the radio before we get into this. I'll tell you what happens. A lot of times, and what the literature will say that the person is having an event. Somebody is having a problem, and they seek care. And they seek care in a chiropractic office, and they seek care in a medical doctor's office. And then they end up having some sort of problem. The prevalence of it happening in a chiropractic office versus a medical doctor's office is no difference. It's not because of the treatment that the person got in the office. It's because of what was going on when they went into the office. That's really the short version of the whole thing is that's how it boils down. There's something going on before they get adjusted. There's something going on before they go see their medical doctor. And then did the doctor catch it before it manifested itself into something bad? So hang on. Okay, everybody, we're back. This is Life with Jason Clemens, DC. We're talking about the safety of chiropractic, or a review of it, okay? This review is a systematic literature research and meta-analysis of the PubMed and Cochrane databases. It included only randomized controlled trials in which cervical high velocity, low amplitude, let me finish that thought. High velocity, take the joint to the end range of motion, and very quickly you add a force. But it's a very shallow force, okay? It's not a deep force. It's a high velocity force to try to because you need the velocity. You need the velocity in order to make it work. And I'll show you if I don't mess this whole thing up right here. For you guys on the radio, just walk it through, okay? Just imagine that these are bones. And let's just imagine that this bone over here is just a little bit to the right of the one that's below it. So I got two books, I got two books stacked on top of each other. And I got one book that's just a little bit offset right there. And then I've got another one that is on top of it that's in line. So we just got this one bone. We got this one bone right here that is just not, it's not out of alignment, but it needs to be adjusted. Okay, we're just talking about this one particular high velocity type of thing that needs to be adjusted. Okay, if I'm really slow, I've got a vertebra, then I got three bones that are right here together. Okay, and this is just an example, so don't get too technical with me. But I got three bones that are right here together, and one of them is not where it's not functioning the way it's supposed to. It's not where it's supposed to be. I hate saying that it's misaligned, because it's not the truth. It's not that it's misaligned, but just so I can get through the example, just let me have a little bit of leeway right here. Okay, just watch what happens when we go slow. Okay, if I've got three vertebrae that are stacked together and one of them is kind of off to the side, and I push this vertebra slowly to the other side or straighten it up, if I push it slowly and straighten it up, what happens is now the vertebra on top of it is subluxated the other way. Like it's moved across, right? So does that make sense? Like I've got three bones. The one in the middle is off to the side. And now if I go really slow, then what I do is I push it lined up, but now the one on top has moved over. But watch what happens if I just go really fast with it. And I may not be able to do this, and I may just cause a wreck right here. But if I hit this really fast, I'll actually move it, and the top one and the bottom one won't move. And I obviously I pushed it too far in this example because it went out the other side. But you see how if I go slow, if it's offset, and the one on the top, we're talking about the one on the top right here. If I push it very slow so that the one in the middle gets lined up, now the one in the top is off out of line. But if I go really quickly, I can work on that bone, and I never move this one on the top. Does that make sense? It's a poor example, but that's kind of how it works. It's low amplitude. It's very, very short. We're not moving these bones a long distance. We're taking them to their end range of motion, and then we're just trying to move this bone just a touch quickly so that it lines back up with the rest of them. Okay? So it's not a big movement. It's just a high velocity, quick thrust adjustment. Just barely moving that very, very, very short distance. That's when they say that's this HVLA, high velocity, low amplitude cervical manipulation, that's what they're talking about. It's like take it to the end range of motion, quickly fire it right there, bam, and then got it. And then that's what you're looking for. Now, I'm not getting into the neurology and all those things that happen. I'm just saying that's what we're talking about tonight. So the patient's ages in most studies range from 30 to 50. Patients' musculoskeletal conditions were mostly neck pain, one of jaw pain, and one was a patient with dizziness and neck pain. The system review and meta-analysis studied men and women of all ages with various musculoskeletal conditions, such as headache, neck pain, arm pain, both specific and non-specific, and acute, subacute, and chronic status. So it's trying to cover everything, right? The manipulation was defined as a high velocity, low amplitude, and was applied to the upper, mid, or lower cervical spine. The HVLA spinal manipulation is defined as a rapid use of force over a short duration, distance, and or rotation area with the anatomical range of motion of a joint to engage the restrictive barrier in one or more planes of motion to elicit the release of restriction. Yes, that's a very proper way of saying it right there. Just trying to release. That's a great way of saying it. The point of the adjustment is to elicit the release of restriction. It's moved over and it's not moving through its proper range of motion. And because it's not moving through its proper range of motion, it's not sending the proper signal from the joint to the brain. It's called disafferentation. Afferent nerves move from the body to the brain. Efferent nerves move from the brain to the body. And we have abnormal movement of that energy pattern because of the restricted range of motion for whatever reason. Okay? So you adjust them quickly, bam. And there's a little bit of motion, and now it's like that has the ability to move through its proper range of motion. And as it moves through its proper range of motion, it fires the neurology to the brain properly, and the brain gets all the information, and now the brain sets the body back into homeostasis or balance. And this disruption, this restriction, and the complex that goes with it in the neurology is what we call the subluxation. The subluxation is that thing that we adjust. The reason we're adjusting it is because we're trying to reestablish proper connection between the brain and the body. And that's it right there, okay? All right. The incident rate ratio of adverse events between manipulation groups and control groups were calculated. Authors also differentiated among major, moderate, and mild adverse events. Major and moderate adverse events are defined as long-term persistent conditions of moderate or severe intensity that results in major impairment and usually requires immediate medical attention. Mild adverse events present as reversible symptoms of short duration and do not require further treatment. This study is the only current meta-analysis of this topic. This was in 2024. Okay, that's a key point. No up-to-date randomly controlled trials-based meta-analysis and/or systemic review has been conducted to assess the increase in the risk of adverse events after cervical manipulation. The reporting of this systemic review and meta-analysis were based on the preferred reporting items for systemic reviews and meta-analysis guidelines. Okay. Neck pain is a common condition that imposes high global socioeconomic burden. We know that. About 65 million new cases of neck pain were estimated worldwide in 2007. Non-surgical therapy strategies such as manual therapy are recommended treatment options in clinical practice guidelines, and are exercise therapy, injections, non-steroidal anti-inflammatory drugs, psychological therapies, and multidisciplinary treatment modalities depending on severity of the problem. Cervical manipulations are widely used by physiotherapists, chiropractors, osteopaths, and medical doctors for musculoskeletal dysfunctions like neck pain and cervicogenic headache. Now, I take exception to that. Actually, the way it's written is actually proper. Cervical manipulations are widely used by all those people, but chiropractic adjustments are not. And there's a difference. And I know it sounds like somatics, but there's a difference. I'm not manipulating you for an outcome that I'm in control of. When I give you an adjustment, I'm simply trying to remove the interference in your nervous system because your nervous system heals yourself. It's your body. Your body is a self-healing organism. It doesn't need to be interfered with, right? So that's the belief system in the chiropractic world, or at least in my world, okay? Because the way chiropractic is going, sometimes it gets a little sideways. But I'm not manipulating your neck. I'm detecting an interference. I'm adding a force. Your neck is either your body, your innate intelligence is either going to accept that force or reject that force. It's not my responsibility for your body to accept that force. It's my responsibility to detect it, decide how we're going to adjust it, and enter the force into the body. Like I had this conversation this morning. I have a pelvis. I have a left posterior pelvis on this particular patient. And when I adjust it, and for the last 2 or 3 visits, when I've adjusted it, she's shaking her head no. If I put her on her side and I go to put her in that position and I enter the force into the body and her head goes like this. Now she doesn't say no, but her head goes like this. And she knows that's not going to move. And so I was explaining, because I've got a student here that's shadowing me and working for me a little bit this summer. And I was kind of explaining to her about movement of the pelvis and the ilium and all that sort of thing. And I said, look, I said, this is what we're dealing with. And when she lay down on the table, it was probably ½ inch between the leg lengths of one side to the other. And that gets very complicated. And if you're a chiropractor, and you know that that's complicated, but we're talking to a lot of different people here. So, but I adjusted her neck. I added a force to her neck and it moved beautifully. I adjusted her thoracic spine and it moved beautifully. I got down to her pelvis and I was going to adjust her pelvis and it doesn't move right now. Now, if I was manipulating her pelvis, I would have this urge to make it move. And that's what I think is a manipulation. And that's what I think, if you don't understand the philosophy of the body as a self-healing organism, I think that's what causes the problems in these situations. I think it doesn't matter if it's a chiropractor or a physical therapist or a medical doctor or a DO, whoever is administering. It's not about manipulating the joint. We're not manipulating anything, because we got up and I said, see how it didn't pop, it didn't release. She lay back down. We looked at it. It was a little bit better, but it was still off. And I said, that's okay. And then I explained to her, I said, that's okay. And I said, I know your head shakes. And she was embarrassed because she wasn't talking to me, and she wasn't saying anything out loud. And she didn't even realize that I was paying attention to it. But and she said, ever since I got in that wreck, my low back is just really stiff. It doesn't want to move. And I'm like, and that's exactly why we add the force to the body, and then the body either accepts it or rejects it. And I said, look, when I adjusted your neck, I just put a very gentle thrust into your neck, and then your neck moved like butter. It was beautiful, right? I said, when I put a force into your thoracic spine moved like it was beautiful. Then when we got to your pelvis, it didn't want to move. Now, what am I going to do? Am I going to override your innate intelligence? See, I believe that there's an innate intelligence that inside her body that says, wait a minute, I'm not ready for that to move yet. You guys continue to do what you're doing. I'll let you know when I'm ready for this pelvis to move. And that is a big difference. That's a big difference between all those people out there that say they can pop your back, or they can move your spine, or they can manipulate you. And I'm not saying that they don't, and I'm not saying that sometimes when you get manipulated by a medical doctor or a DO or a PT or whatever, that you don't get some relief and it doesn't function better, right? But it's not a chiropractic adjustment. It's not the same. And it's not the same because it's not the same philosophy. Okay? But when they're talking about it in an article like this, they can't differentiate between those things, because it's somewhat subjective. It's not objective, right? But they're saying cervical manipulations are widely used by a bunch of different people for musculoskeletal dysfunctions like neck pain and cervicogenic headaches. The use of cervical manipulations remains controversial. To who? That's not controversial to me at all, since it is often considered to pose a risk for not only benign adverse events, such as aggravation of pain or muscle soreness, but also severe adverse events such as strokes in the vertebral basilar or carotid artery following dissections. I'm in my 21st year of seeing patients. There's no possible way a person can keep a business open for 21 years if they're creating havoc with the patient that they're taking care of. It's ridiculous. It's ridiculous to be held to a standard that's not even the same standard of the deaths from Tylenol or adverse medical reactions or any of that sort of thing, right? So I just, it's controversial to some people, whatever. Studies finding an association between cervical manipulation and serious adverse events, such as artery dissections, are mainly case control studies and case reports. Case reports, individual case report. Patient presented to chiropractor, patient got adjusted, patient has an artery dissection. Fair enough. Case report. The question is, why did the patient present to the chiropractor? What was going on with the patient when they presented to the chiropractor? And the prevalence of it is if they presented to the medical doctor or the chiropractor and they were having an event, it's more than likely going to keep manifesting itself. That's the truth right there, okay? Studies finding an association between cervical manipulation and these are case studies. These study designs are not appropriate for investigating incidences and therefore do not imply causal relationships. It's very important that we understand that, right? Randomized controlled trials are considered the gold standard. Cervical manipulation is considered to be a risk for benign adverse events such as aggravation of pain, muscle soreness, or headache. I guess I could share this with you while we're going over it. I don't know why I'm not, but okay. Let me get, where were we? And for severe adverse events such as post-dissection vertebrobasilar or carotid strokes, disc herniations, fractures, or spinal cord compression. Studies that find an association between cervical manipulation and serious events such as artery dissection are mainly case control studies. That's what I'm saying. There was a big one in Los Angeles a couple of years ago. There was a model that had been doing a shoot for like 11 or 12 hours in a day. At one point, she fell off of the stage. Her neck was really sore. She went to the chiropractor. She got adjusted. She went home. She came back the next day. She got adjusted again. They did subtractioning, whatever. She went home. Then she had a stroke. And I think she died. And then the coroner blamed the whole thing on the chiropractor. It's like, if it was any negligence in the chiropractor's part, it was that that the chiropractor didn't catch the event that was taking place. Okay, that's the case report. And that's a scary thing for all of us. We want to make sure that that's happening. And there's questions we can ask to make sure that that's happening. Okay. These study designs are not appropriate for investigating incidents and thus do not imply causal relationship. The annual incidence of internal carotid artery dissection is estimated at 1.72 per 100,000 members of a population. The retrospective case report series and review of case reports found that arterial dissection was the most common serious complication after the application of cervical manipulation. However, due to the lack of methodology, these studies designs do not allow any conclusion about the causal relationships between the cervical manipulation and the serious adverse events. Key point, and this statement references these studies, and it's got these multiple studies that it references right there. Okay, so it's you got to pay attention. You got to do your due diligence. You got to make sure that there's not an event taking place, and those are the things that are really the truth. There's a bias. Case control studies that show an association between cervical vascular injury and spinal manipulation are suspected to come from whatever this is, protopathic bias. I don't even know what that means. Protopathic bias arises when an exposure to initiated in a response to a clinical sign of an initial undiagnosed illness may lead to an erroneous interpretation of a harmful association between exposure and disease. That's patient could be seeking care in the form of cervical manipulation due to head and neck pain, which are also pre-symptoms of dissection-related stroke. That's what I've been saying. That's the truth right there. Hence, manipulation is erroneously associated with subsequent dissection-related stroke. The event is taking place. The person goes to the doctor. The event continues to take place. The doctor gets blamed for whatever happened. That's really what the literature says is the case. And it's not any more prevalent in the chiropractic office than it is in the medical doctor office. It's not any more prevalent. Okay. Um, Studies that try to overcome this bias by applying population-based case crossover design compared the risk of serious adverse reactions, such as these strokes associated with cervical manipulation, to the risk associated with visits to primary care physicians. The results showed that no difference of risk could be detected. That's what I just said. Okay? There's no difference. It's devastating if that ever happens. It's never happened to me in 21 years. I've got malpractice insurance rates that prove it. The safety of what we do, we're not dangerous. It's not dangerous to get adjusted if you get adjusted properly. It's not dangerous for a child to be adjusted if you get adjusted properly. It's not dangerous. You got to pay attention to what you're doing, and you got to make sure that you're doing your due diligence. And and so and that's what it says. Therefore, a conclusion regarding the association of cervical manipulation and serious adverse events cannot be drawn. These studies are cited for this bias. And then clinical implications. Headache and neck pain are typical symptoms of cervical artery dissection. Okay? Often, they may be the only symptom of this and masquerade as musculoskeletal origin. Now, when we do studies on that, there's a specific distribution. There's two main specific distributions that are red flags in our office. Number one is a patient uses a knife edge or a finger, and they go from the basically underneath their jaw down towards their sternum on the inside of their SCM. That SCM muscle, that artery runs right on the inside. And what they say is that my neck hurts right there a lot. Not on the outside of it, not at this point of it, but they go downward in that angle. I'm having pain right here. If a patient says that to me, that is an automatic red flag. And I've had it twice. One of my girls got hit in the face with a volleyball. She didn't see it coming, and her head was turned, and it hit her in the face, and she's like, it hurts right here. And I couldn't tell exactly where she was pointing, and I asked her to point it out multiple times. I said, where are you talking about? Are you talking about, is it in the muscle or is it in front of the muscle? And she's like, it's right here. And it seemed like it was in front of the muscle. And I stopped what I was doing, and I told her parents, you need to take this girl to get her evaluated. They need to do an ultrasound, and that needs to be done. Now, the parents didn't follow through with what I said, and they didn't do it, and the girl was fine. Okay? But the initial, that was the way that we handled it in the office. The other one is for one finger in this little triangle right underneath your skull, right? There's a point right there. It's called the mastoid process. It's right in front of that, and it's one finger, and it's the statement is, I woke up this morning with the worst headache that I've ever had in my life, and I have no reason, I don't understand why. There's no reason for me to have it, and it's right there. And that's happened to me one time in 125,000 adjustments. It's not a hand. It came over the top of my head. It's not any of those things that right there. It's one specific thing. So those are two of the red flags that might help us if the person was to present in the office. That might be something that we would that would be a red flag for us and say, hey, look, because these are clinical implications. Now, you know how many people come into the office that have neck pain and headaches? Like, there's a lot of it, and you don't need to be over exaggerating and send them all for an ultrasound to make sure that there's no dissection going on. But the times that I've made recommendations like that have been to err on the side of caution. I can't miss once. I got a zero tolerance policy on that. For my entire career, I can't miss that. If it ever walks into my office, which so far, knock on wood, it hasn't, but I can't miss on that, right? I gotta pay attention and when to what I'm doing. We keep it loose in here, but that's every patient that comes in my office. I'm paying attention to that right there. And the literature says that it's okay, right? We got about 30 seconds right here. And Um, in clinical practice, there are no sufficiently valid tests that exclude or confirm serious pathologies. Here's the findings. No statistically significant differences between the manipulation and the control groups. All the reported adverse events were classified as mild, and none of the events reported were serious or moderate. No serious events were detected following this HVLA manipulation in the studies. These and they are consistent. So we'll get into it a little bit more. We'll just finish it up tomorrow night, and I'll show you a couple of articles that you can also take with you, just so you know. So hope that was helpful. A little bit about the safety of chiropractic. You guys have a great night. We'll be back tomorrow night at 6.